believe that women should be able to be confidently able to be in intimate relationships without a fear of HPV, even if their partner might have it. Because the fact is that when we have your systems in optimal way, right? If your immune system's working, your microbiome's working, your vaginal microbiome's working, you've got your nutrients, you're protected, then you will be able to have sex either with the same partner or a different partner who may have HPV, and you'll be able to protect yourself. Because again, it's not just about exposure, it's about your body's protective mechanisms.
Well, welcome back, everyone, for another episode of Healthy Rebel Speaks Out. And I am your host, Bonni London, and it is my mission here to help the people who watch this to feel empowered, to take care of themselves with the proper information, to have the proper access. And today is no different, but we're talking about kind of a serious topic that is kind of uncomfortable, I believe, for some people to talk about. And I have an amazing doctor, Dr. Donnie Wilson, who is an amazing naturopath doctor, professional midwife, nutritionist, and a best-selling author to boot of several books. But today she is here to talk about her protocol with helping those of us, which you're going to learn today because the numbers are huge, who suffer with HPV virus, which we know is the biggest cause leading to cervical cancer. So this is huge. So thank you, Dr. Donnie, for joining us today. So I have to begin by asking, how did you obviously were interested in women's health, of course, but how did this become such a passion? Because it certainly is a niche.
Absolutely. I mean, actually, back in my early 20s, I was in the gynecology office dealing with HPV myself. And that was when I was also getting my pre-med degree. So I was in the midst of figuring out, what do I want to do with my career for my life? What do I really want to continue studying? And so I was getting a pre-med degree and at the same time dealing with my own health issues, in my 20s. And I found myself sitting in the gynecology office with all of that fear and confusion and overwhelm and feeling alone and feeling isolated and all the things that women feel when they go to the gynecology office and they're diagnosed with high-risk HPV or an abnormal pap smear, and you're just like, there's so much shame and stigma associated with high-risk HPV virus as a sexually transmitted virus. So at that time, there was something about going through that experience for me in the gynecology office that I started going, first of all, I'm interested in helping women in this way, right? I started thinking, I would like to shadow a gynecologist. I would like to know what it's like to be a gynecologist and a women's health expert. And so I actually did. I actually asked my gynecologist if I could follow her, and I did as a pre-med student. And so it was that part of me that was like, hey, this women's health is very intriguing to me because it's also something that I was experiencing. And I could also see that women need more help. I wasn't getting enough help, and I wanted to be able to help others more in the same way that I was needing to get help. And so at that time is when I also shadowed another gynecologist, and that's when I found out about midwives. And I was like, wow, that's even better, because now this is a way that we can offer women's health care in a form where we can be more present and spend more time and be more supportive from a midwifery perspective. And at the same time, I decided to get a nutrition degree. So I was getting both a pre-med degree and a nutrition degree. And I had this thought one day, Bonni. I was like, isn't there a medical school that does both? Isn't there a medical school that does medicine and nutrition, food as medicine? And
Yes.
As soon as I asked that question out loud, a friend of mine said, well, there's naturopathic medicine. And that really is what naturopathic medicine is. It's this whole different perspective of saying, hey, how can we look at this as, yes, as humans, we're going to be having some health issues, and how can we support our body to prevent those health issues, or use diet, nutrition, nutrients, and herbs and other natural approaches to help ourselves recover from those health issues. And so that's what led me to Bastyr University. And I went to Bastyr University, which is the leading naturopathic medical school. I went to the Bastyr campus in the Seattle area, and they had both a naturopathic doctorate program and a midwifery program. And so I was able to study both at the same time and continue to become a women's health expert. And so at that time, I also, after doing a residency, I did a residency in midwifery, a residency in naturopathic medicine, and I then had the opportunity to do an additional residency or internship with Dr. Tori Hudson. Dr. Tori Hudson is a naturopathic doctor in the Portland, Oregon area who has written essentially the encyclopedia of women's health using natural approaches. And so she was not only my teacher and mentor, but I was also interned with her, learning how to help women with HPV and abnormal pap smears, amongst other women's health issues. And so when I finished all of that and I moved to, I've been in New York, in the New York area for over 22 years, then I started really specializing and receiving a lot of referrals.
Well, there's a gap. Like
for women who need help with this. Yeah. So that's how I just, from all the way back then in the early 2000s, I've been helping women with abnormal pap smears and HPV because of them.
Yeah, so I want to talk about the numbers here because they are kind of big, which I did a bit of research I was mentioning, and they say about 42 million Americans have the HPV virus. Now, have these numbers gone up since you've been doing this?
Yes, well, and I think it has, and for a couple different reasons. One is, a couple decades ago, we didn't always test for HPV, right?
Oh.
So a couple decades ago, the guideline was you would do a pap smear first, and if the pap smear was abnormal, then you would test for HPV. Now, most doctors are testing for HPV at the time of the pap smear or even before doing a pap smear. And so, first of all, we're testing more. So we're going to...
Oh, that's interesting.
Also, it's well established that during the pandemic, there was an increased rate of HPV. One, because of the stress of the pandemic, also because even being exposed to COVID increased risks of HPV. So those are a couple of the reasons why I believe that the rates have increased of people being diagnosed with HPV. Now, mainly it's women who are being tested, right? Still in the United States, men are only tested for HPV once they develop a cancer caused by HPV, but women are being tested with their pap smear and gyne exam. So women are the main ones that are being...
So they could be... So you said a lot of important things here that I just want to highlight. First of all, yeah, so men can be asymptomatic, which is how, of course, they can spread it. But the other thing you said, which I know we're going to talk about, to me, this is huge, 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 thinking about stress and COVID and all of that. So regardless of being exposed, to me, what you're saying is that us, taking care of our bodies and our immune system, it's like that is like the core of this entire discussion today. Does that make sense?
When women are going to the gynecologist and they end up testing positive, you're one of the 6 million women every year who are testing, additionally testing positive, right? So every year, millions of women are testing positive for HPV. Millions. It's a lot of people getting that phone call. And at that time, your doctor's office is likely to still tell you that there's nothing you can do to get rid of it, that all you can do is wait and see if it's going to cause abnormal cells or cancer. And so, of course, women go into a panic. I mean, if you find out you have a virus that could cause cancer and the doctor's saying there's nothing you can do about it, that's very stressful in itself. But the fact is, Bonni, in the research, there are numerous research studies that document that it's possible for the human immune system to fully clear the high-risk HPV virus. That means that there is something we can do about it. The human body can clear it. And like you're saying, it's not just about exposure. While millions of women are being infected and testing positive every year, the number of women who actually develop cancer is much lower than that. So it's not about you get exposed, you test positive, it develops into cancer. That's not how it goes. It's millions of people get exposed, some amount of those people will test positive, and a much lower number would ever develop cancer from it. Right? So we have to, I think, first
Now, this is so important because I mean, you're giving like agency to these patients that they could do something. Like even when people get some, even scarier diagnosis, even to the point of cancer, but at least when they feel like there is something I can do that can make a difference.
absolutely, there's so much we can do to make a difference. And so if your doctor has said to you, there's nothing you can do, or you just have to wait and see, or you just have to keep doing procedures, then I encourage you to learn more, because there's so much research. There's so much research into these things we're talking about: diet, nutrients, herbs. There's so many things we can use to, and not only that, but what I do is I look into, okay, if we know that stress is making us susceptible to high risk HPV, that it's not that we're going to try to eliminate all the stress, because that would be impossible.
Sure.
But what we can do is we can help our bodies to recover from the stress we're exposed to, and to learn how to integrate stress recovery into our day-to-day activities so that the stress doesn't have a chance to make us more susceptible. This is how I talk about it, is I talk about it as we need to look for what's making your body susceptible to high risk HPV, and ask the question, why? If your immune system, if the human immune system has the ability to clear this virus, why is your immune system not clearing it? And when we ask that question and dig deeper, that's when we can solve this.
Yes, well, I just have to say, I wish I had you back when I was like 23 years old when I got diagnosed with HPV. But looking back now, I think I had just graduated college where there was a lot of partying going on. And I think this explains everything. And it definitely, a lot of stress. But it was incredibly stressful going through this entire thing by myself, basically. And I'm fortunate. I did have the cancerous cells, and they did the procedure. And then for years, they would watch me basically every 6 months, and it didn't come back. But nothing was ever spoken, not one word about lifestyle, stress, and nothing ever. It was just, we're going to watch you, right? I think that's typical, right?
It is. I'm so glad you're sharing that. That's, I think, so many women who are listening who've been through this, right? You get this, you go in for your PAP and you're thinking, okay, everything's going to be fine. And then you get this result back where it maybe shows high risk HPV of one of the strains. We can talk about that. There's different strains. And then maybe it doesn't show abnormal cells, or maybe it does show some degree of abnormal cells. It's a variation, right? It's a spectrum. So if you go from mild, right, you might, at first the HPV virus comes in and it's in the vaginal area. Now it prefers to go after the cells of the cervix. And so if it goes straight to the cells of the cervix, it actually, I say it's like it hijacks the cells. It literally goes into the cells, into the nucleus of the cells. It's a DNA virus. So it goes into the nucleus of the cells and it takes over and starts to make the cell look more and more abnormal. So when they do a pap smear, they're taking a sample off the face of the cervix and inside the opening of the cervix. And what they're looking on a microscope, and they're seeing, hey, do these cells look like they've been affected by HPV? And are they mildly affected, like what's called CIN1? Or are they in the middle to high grade, which would be CIN2 to CIN3? If it's anywhere in that range from CIN1 to 3, This is all before it turns into cancer cells, right? So after CIN3, then it goes to what's called carcinoma in situ before it would turn into actual cancer cells. So I'm actually always so grateful when a woman goes in to get a pap smear and finds out, hey, it looks like there's HPV and there's some abnormal cells, because to me, there's so much we can do to be proactive in that time frame before it turns into cancer. I'd much rather be proactive then and prevent it from going into cancer.
Sure.
And so, you might get those results. Now, if it shows a little bit of abnormality, your doctor's likely to recommend a biopsy called a colposcopy. So then women are getting a colposcopy result back. And if it's CIN2-3, that's when the doctor is likely to recommend what's called a LEAP procedure in the United States. In other countries, it's called a LET procedure, but that's to remove the abnormal cells. If it becomes more advanced than that, then they might talk about a conization, which is removing part of the cervix, or even a hysterectomy to remove the cervix and the uterus. And so, don't be surprised if the doctor starts mentioning these procedures, because you have to remember, when you're talking to a gynecologist is really a surgeon, right? That's what they're trained in, is to do surgery. So when you're talking to a surgeon and they're looking for abnormal cells, if they see these abnormal cells, they're going to recommend a procedure or the surgery. They're well trained in what they do, but they're not well trained in nutrition. They barely learn any nutrition. They definitely don't learn about herbs or mushroom extracts, or how to help patients recover from stress and prevent the progression of high-risk HPV virus. So you just have to keep in mind, I always say, keep in mind who you're talking to, right? If you're talking to a surgeon, they're probably going to talk about the possibility of surgery. If you want to learn about other options, you're going to want to talk to someone who has different training.
So you can reverse it?
What I do is women come to me, by the way, they come to me from all different ages. I see women in their 20s, 30s, 40s, even women up to their 70s and beyond who are dealing with abnormal cells. And sometimes these women have been dealing with HPV and abnormal cells for decades of their life. Is really, to me, it's heartbreaking to know that women are struggling with this, and they're going like you did. You have to keep going back every 6 months and do another.
It's like a dark cloud. That's my analogy. It's like walking around with this dark cloud, like it's out there. Right? Does that make sense?
And some women are dealing with this, and they're going through multiple procedures, or even they could have a hysterectomy. But when you have any of these procedures or a hysterectomy, it doesn't kill the virus. So
this is my question. I have an important question.
The virus can cause abnormal cells again.
This is my big question, because we know it loves the cervix, as you explained, but it's in the entire body. So how does it affect other organs in the body? Does it, I'm assuming it does. Do other things.
When say the person had a hysterectomy and no longer has a cervix, what's more likely is then the virus will start bothering the vaginal cells, and they might end up with abnormalities in the vaginal tissue. Now, that can happen even for a woman who still has her cervix, but it seems to be a little more often once they've had a hysterectomy, and then they think, oh, I'm good, I had a hysterectomy, it's gone. And then a year later or 2 years later, they end up finding out that there's abnormalities in the vaginal tissue. So even if you have a hysterectomy, you still need to be tested for HPV and abnormal cells, is one thing to know. And the virus can also cause abnormal cells on the vulvar area, which is the outside area, outside of the vagina. And also it can cause abnormalities in the rectal area. And it can also cause abnormalities in the oral and sinus area. In fact, 70% of sinus and oral head and neck cancers, 70% are caused by high-risk HPV virus in men and women.
Wow, and then how do you test for that?
It's not well tested. I think it should be tested when you go to the dentist for your teeth cleaning, because there is tests available where you do basically like a swish and spit, and we should all be tested for HPV when we go to the dentist, but it's not the standard of care yet. So right now, it's only if they start to notice a tumor or an issue, then
but by then it's already so progressed.
Exactly.
I mean,
but it's because in the standard of care, there's no other treatment. And so they don't test because they don't have a treatment. But
Right.
from my perspective, as a naturopathic doctor and women's health expert who've been helping people with HPV for decades, to me, there is a protocol. I've developed a protocol I use with my patients every day, and I've helped so many women to be able to reverse these abnormal cells. So especially when women come to me with let's say just HPV, I can help them to support their immune system to clear HPV to negative and keep it negative. That's the other thing, is there's another myth that it's going to come back again. And what I find in my patients when they follow my protocol is it doesn't come back. I have patients who saw me over 15 years ago for HPV and it's not come back. So
Right.
it doesn't, if we follow a protocol that works, we can actually help the immune system, because the human immune system can fend off high-risk HPV, and we have a memory part of our immune system, and it can remember HPV and protect us going forward. But it's not integrated into the standard medical system, and so they're just leaving it to deal with it once it causes a problem. And I'm saying, why wait? Let's find out that it's there and start taking action to prevent cancer. Because I consider cervical cancer and really all forms of HPV related cancer, I consider them to be preventable.
Yes, and it seems it all comes down to the immune system, obviously, like the host. Yeah. So
It's
could
our
you?
immune system, yeah. It's our immune system should be able to, but our immune system, right, it gets depleted by stress. When we're under stress and our cortisol is too high or too low, that affects our immune system. And it's very clear in the research that the cortisol disruption causes a deficiency in our immune function, and we become susceptible to all different infections and cancer, including HPV related cancer. Also, then when the microbiome gets disrupted, so what's happening also is the stress disrupts our gut microbiome, and that disrupts our vaginal microbiome. And when in the vaginal microbiome, I think of it as like our bodyguards. You know, this is our little bodyguards in the vagina that are helping us to protect us from all different infections, including HPV. So when women who, if you think about it, women who are exposed to HPV but never test positive and never have abnormal cells, their immune system and their microbiome was able to fend off the HPV, right? But the women who were exposed and ended up with a persistent infection and abnormal cells, it's that their immune system was depleted and their microbiome was depleted. And these are things that we can fix, right? We can help reoptimize cortisol levels. We can help reoptimize the vaginal microbiome. So these are things that are fixable, but they're not being tested or addressed in the standard medical system.
So could you go into a little bit of some of the facets of your protocol, basically, and all your holistic approach, basically, of what you would?
This is absolutely, and it's so important. I always emphasize we need a comprehensive plan.
Yeah, it's never one thing.
People will be, searching, on YouTube and social media, and like you can find some different products that are being marketed for HPV. But I always warn people, it's a lot of them are not harmful, but they may not be effective, because if you're just looking for this quick fix or magic pill, that's likely not going to work in this situation, to be honest, right? It's not about just, take this one pill for the rest of your life and you'll be good. To me, that's not a real solution. I'm not aiming for people to have to keep on taking something for the rest of their life. And it's also not a solution for me for it to just come back again every year, right? We want to be getting this to negative, the HPV to negative, and we want to keep it negative for the long term. So if that's our goal, we need a comprehensive plan. And I would start that even from what I refer to as your self-care. I use CARE as an acronym. So the acronym of CARE stands for clean eating, adequate sleep, recovery activities, and exercise, right? These are these foundational, I know you talk about these things too, right? These are these foundational ways that we can take care of ourselves on a daily basis. But when we're under a lot of stress, right, and we're a mom and we're running a business or we have a job and we're doing a million things for everybody else, we're not doing this care for ourselves. We're not getting the food we need for the nutrition we need. We're not getting the sleep we need. We're not getting the even recovery time we need, let alone the exercise we need. So we have to start there. We have to come back to taking care. In fact, I would say that HPV and cervical cancer risk is really an epidemic of lack of self-care for women. And right, this is women, we're not taught to take care of ourselves. We're taught to take care of everyone else.
Sure. And then I'm just guessing, in addition to the other things you mentioned at the beginning of the podcast that have like increased the numbers, there is no question, since the 90s, introduction of GMOs, pesticides, and so like it's much harder to eat clean, like you say, because so we're even those that try to eat healthy may not be getting all the nutrients that they need, and they may be getting stuff that are actually causing more stress on the body. So I feel like that has just like complicated this entire situation. Just our environment.
Absolutely. So this in some of these things we feel like, okay, what can I do about that? Because we get exposed to toxins in our food, our air, our water.
That's crazy.
And then let alone we're exposed to stresses from every angle too. And so it can feel so overwhelming that a lot of times it's paralyzing for women. They're like, what can I do about this? How do I even begin to start to solve this for myself? Because they're already overwhelmed in their lives. And so to me, it really starts with step by step, right? We just go little small steps. I say I do a free online workshop training, and I also teach a group online program. And I say to women, it's like if you see a mountain, you're not gonna climb over the mountain in the next hour or the next day, right? We're gonna go, because at first you look at this mountain and you're like, how am I gonna do that? No, you can't do that in one day. You're gonna go step by step. You're gonna go little by little, and you're gonna learn along the way. And then before you know it, you're gonna be halfway up the mountain, then you're gonna get to the mountaintop, and then you're gonna be on the other side. But it's step by step. Same thing as a concept of learning to ride a bicycle, right? You don't just get on a bicycle and you're a professional bicycle rider the first time you get on a bicycle. We need to learn to take little steps. Go, how can I get on the bicycle for a couple minutes and understand that it's going to be wobbly, and maybe I need some training wheels, and I need some lessons, and I need someone to coach me. And now I'm going to try this a few times, and little by little I learn, how can I integrate clean eating? What foods can I buy at the store? What foods work for my body? How can I shift my sleeping pattern so that I can get more hours of sleep? And we just tweak and make and fine tune little by little. And that's how we make these changes. It's not like if we go aim for perfection, we're gonna never begin.
Right. And also I think, it's always good to mention as well that anyone that comes to see you, it didn't happen overnight. Yeah. Like, this is not like anything is going to happen in 24 hours, even if they get, the HPV. Like, you didn't get to this place where you are, so you don't have to reverse it also in like the next week. Right. I mean, just to me, that makes sense. But so often, I find that people, even though they've been struggling with this for so long, when they finally decide, they think, maybe it should happen fast.
And believe me, you wish it could, because when you're in this situation, you feel like, it can take over. Women report to me, they feel so afraid, so alone. Sometimes they're crying all day. They're so anxious and worried. It's affecting their work. It's affecting their relationships. And they're like, I need this addressed now, And so it feels very urgent. And yet it's something where actually the solution comes when we have a very strategic plan and you start making changes little by little. That's when we make the long-term results, because this is not having HPV and abnormal cells. Like you said, it's not something that came overnight. It's something that it's a situation. In fact, a lot of times what I say is that HPV showing up positive is more of a messenger. The HPV is showing us there's something going on here.
It's the host. It's the host. It's the host. I interviewed someone back last year with breast cancer, and that was also the whole message was not. I mean, it's not something wrong with the breast specifically. It's the host that allowed this to kind of occur, and
Yes.
that you should look at it as like, this is great. Now this is fantastic. Now we know this, and we can put like a kibosh on it, basically,
And
right?
it can become a pivot point for women. When women start to understand that, they go, "Oh my gosh, I know I've been needing to take better care of myself and I just have been procrastinating it. But this HPV and risk of cancer can be the thing that finally says, okay, I'm not going to procrastinate and put myself on the back burner anymore. Today's the day where I'm going to start prioritizing myself and my health and my future and take my body back from this virus, because the virus will try to take control. It's literally hijacking the cells and doing what it wants to do with your cells. So it's time. We have to literally be like, wait a minute. I did not sign up for this. It's not okay with me that this virus is doing this to my body. I'm going to be the one who decides what happens with my health. And when we become more empowered like that, then making these decisions becomes much easier, because we're like, I'm no longer willing to eat in a way that makes me susceptible to this virus. I'm no longer willing to, be exposed to toxins that might be making me susceptible. And so we guide women through a process of really healing their whole system, right? We have to, the terrain, as sometimes it's referred to, right? We need to do the gut
Sure.
healing. We need to look at gut health, microbiome, and we need to look at nutrient deficiencies, hormone imbalances, including estrogen imbalances, either estrogen being too high or too low. We need to look at estrogen detoxification. We need to look at also, like you're mentioning, toxins, including mold toxicity, which depletes our immune system and makes women susceptible to HPV. So we need to go through a process of identifying which of these 8 susceptibilities are making you susceptible, and then those are all things that we can address. We can work step by step to address those susceptibilities, and in doing so, then your immune system and your microbiome come back online and start protecting you. Now, the other key part of my protocol is that instead of just focusing on one supplement, what I've done is gone through the research, and based on my clinical experience with thousands of cases, I've identified which supplements help in the most cases. And so this way, then I can say, oh, here's the supplements that we're finding are working. And it's not just one thing, right? It's not just a mushroom extract. It's not, the other thing I find is that a lot of people might be taking some random supplements, right? They might be taking a little bit of D and a little bit of C and a little bit of E, but it's not in clinical doses. And too,
Right.
as a clinical nutritionist, like with clinical nutrition, we can use nutrients at clinical doses for physiological effect. So when we know that the person has a nutrient deficiency or a health issue like HPV and abnormal cells, we can use clinical doses that are not going to show on the label or online. You have to work with a clinical nutritionist to help guide you on those doses.
And also, and making sure you're getting high quality supplements, because these things, people don't realize it is not regulated at all by the FDA. So it's kind of like the Wild West. So you can't just go to your local pharmacy or big store and think this is going to be the same. I mean, they've actually done studies now that show that some of it doesn't even have any of the stuff in it. So you really need to look for ones that use third-party verification, maybe even certificates of analysis. So they can, I mean, I have seen the supplements for sure be, like life altering for people when you get them on the right thing. But it is in combination with all the other things that that you are saying. But
Yeah.
no,
And
this
it's so
is
true. You have to get the right formulas, the high quality formulas, and at the right doses, and to pick the ones that are going to be the most effective. And I think a lot of times, another thing that we do as women is we think we're going to figure it out ourselves. We got to do it ourselves, right? And so we start searching and trying to figure it out on our own.
overwhelming. It's
As you and I
overwhelming.
know, it took years of education and experience to know how to do this, right? So I would
Sure.
say, like, if your toilet breaks, you're probably not going to just try to go on YouTube and figure out how to fix it yourself. You're going to hire a plumber to fix the toilet. So, with this too, for women to realize, hey, it's worth it to work with an expert who can guide you, because you're going to save so much time and angst, and you're going to be so much more efficient and effective when you have the right guidance. And
the mental part of this, I'm thinking of two things: that women, we don't have to feel bad anymore that maybe you picked the wrong guy. I'm just saying.
That's a good
that's
one. I like that. It's true. You start to go,
okay, well, I'm serious. I mean, I think you could feel bad when you how did this happen, even though it's so common and you're human and whatever, that there's really much more to the story than just making a bad decision.
I'm so glad you're saying this, Bonnie, because so many women, when they contact me, this is where they are.
Shame. That's what I
thinking. Who gave this to me?
Yes.
When did they give it to me? Why me? And you're trying to solve this mystery, but the fact is, there's no test that can tell us exactly who gave it to you or when, and so it's an unanswerable piece of information.
And it doesn't matter, and there's much more to the story.
There's much more to it.
So don't feel bad anymore, anyone. No more shame on that.
Yes. What I say, listen, HPV virus is so common. And so I say, we're all human. Humans have sex. There's nothing to be ashamed about that. That's something humans do. We're humans. Humans have sex, and humans who have sex get exposed to HPV virus. It's that common. The studies show that 80% of women will have tested positive or been exposed to HPV by age 50. 80%.
Oh my God, that's crazy. Which brings up a question I mentioned. I did want to ask you what your opinion was on the vaccine, because I mentioned, when my daughters were like 12, I'm not going to say threatened, but it was like they're getting it. Like I was told they have to get it kind of thing. And I didn't know enough to really think about diving in deeper, but I know there's more to the story. So
that is one thing that the conventional medical system can offer, is a vaccine. But like with any vaccine, I always recommend that you always do your research. Any substance you're going to put into your body, whether you're even a food, even a herb, even indefinitely a vaccine, you want to research what's in it. What are the potential benefits? What are the potential risks? So do your research before you choose anything for your health. And in particularly for the Gardasil vaccine, which is the HPV vaccine. So this vaccine, one important thing to know is it's not 100% effective, but the doctors probably don't tell you that, right? The doctor is going to say you need this vaccine, but they're probably not going to say it's partially effective. But that's what's true, is that it's partially effective. One thing for sure is that it's covering 9 types of HPV. Now, with HPV virus, when we talk about HPV virus, it's actually, there's more than 150 different strains of HPV virus. Some of the strains of HPV virus are considered low risk, meaning they are not associated with cancer, right? They might cause warts, even warts on your hands or your feet. That's HPV virus, but it's a low risk type, not associated with cancer. Or genital warts are caused by low risk HPV that are not associated with cancer. So there's, as far as we know right now, at least 14 types of HPV that are associated with cancer risk, right? So of those 14, only 7 of them are covered in the vaccine, right? So if you have the vaccine, you're only covering half of the high-risk HPV viruses. So you could get the vaccine to cover you for half of them, but the other, if you got exposed to any of those other 7, the vaccine doesn't cover those.
Now, how common are the other 7? Like, are they equally as common? Like you would just like me to.
I don't know exactly the distribution, but what I can say to you is, in terms of, because you mentioned earlier that high-risk HPV is associated with 99% of cervical cancer. And 70% of those cervical cancers are caused by two different types of HPV, 16 and 18. So 16 and 18 are covered in that vaccine, right? So it's that's why I say it's partially effective. It's covering for type 16 and 18, which covers you for 70% of the risk of cervical cancer, but it's not 100%. And this is why I hear from so many women who say, I got the vaccine and I'm still dealing with this situation. I'm testing positive for HPV, I have abnormal cells, and some of them even still have HPV 16 and 18, even though they had the vaccine. So I just want people to know that, yes, there is a vaccine, but it doesn't mean that you're going to be fully protected, and it certainly doesn't mean that you can stop being tested. It's absolutely clear that you still have to be tested for HPV, and you still could develop abnormal cells.
So the other stuff that we're talking about today, just your immune system, like that, I mean, it's for everything. I mean, it doesn't go away. You know,
Exactly. So that's the thing, is like by the time you go through this process, I call it a heroine's transformation, really. You know, there's a Joseph Campbell wrote this idea in this book called The Hero's Adventure, Hero's Journey. And it's a concept where when we face some issue that we didn't choose, but it's an issue that we face and we have to deal with it. And through the process of dealing with this situation, we learn new skills. We even maybe find someone to support us or guide us. We learn about ourselves. We start to integrate and implement new things into our life, into our body, and we come out the other side of it as a changed person, right? We've really learned about ourselves, and now we've integrated all of this into our day-to-day for our future. And so I see this happening for women who are going through my Say Goodbye to HPV program, and I also work with women one-on-one. When they face HPV, because it is such a scary thing in their life, and it's causing them to relook at things, right? And relook at how they've been feeding themselves, how their nutrients are doing, how their hormones are doing. And they go through a process of integrating all of this new information into their life, and they come out the other side of it, and they're now going to want to maintain that new way of self-care and maintaining their health, because they now see how much it's benefiting them on so many levels. They start seeing women report to me, my hair looks better, my skin looks better, my digestion's better, I lost 14 pounds I was trying to lose. And
they just feel better.
They're healthier.
It becomes a motivation in and of itself, just feeling good. So the question is, I guess I'm thinking about going back to that initial appointment that they get the diagnosis or going to the doctors, like how, and they have no idea that there's other answers out there. So I guess, how are people just finding you on the internet? I'm just wondering, is that it?
Because now women are more likely to start searching on Instagram or TikTok or YouTube, and they're like, I love it because women are thinking, even though my doctor says there's nothing I can do, there's got to be something else I can do. And so they start searching, and that's where how we find each other. And usually when women find me, they think it's like, answer to their prayers. Because
Sure.
there's very little support for this out there in the world, and I really see that it's become, because I've spent so many years helping women with it, it's really become my passion and my purpose. My goal is to help at least 1 million women prevent cervical cancer, and then I'm going to keep going from there, because we can decrease the rates of cervical cancer and other HPV related cancer. I'm completely convinced, based on the women who've proven it to me. I'm going not just based on the research, I'm going based on thousands of cases that I've helped over 25 years. And so I see it over and over. Another key piece of the protocol, by the way, that I didn't mention before, is we also directly support the vaginal microbiome and the vaginal health, because there's ways we can use herbs and nutrients vaginally very safely and effectively, including probiotics vaginally. And this is not available. This is not something that your regular gynecologist is likely to mention. And it's
No.
not something you can find over the counter in the United States. And so you need to be working with a practitioner who can give you access to these professionally made vaginal suppositories that can help you to heal the vagina, the vaginal tissue, especially for women who are peri and postmenopausal, Bonnie. Because what happened, right, with postmenopause, the estrogen drops vaginally. And when estrogen drops, it disrupts the microbiome and we become more susceptible to HPV. So this is why I'm seeing a lot of women around age 50, 55, 60 testing positive, and they've not been using vaginal estrogen. And now the research is very clear that this is essential for women postmenopausally to be using vaginal estrogen, unless you have some very rare cases, you know, of recent breast cancer history, you need to talk to your oncologist. But for most women, vaginal estrogen is so important, and yet most doctors are not telling women. And so they're left vulnerable to HPV in their 50s and 60s. And I can help them heal that. We can get the estrogen back online. We can get the microbiome back online. And now their vaginal area is protected again.
And I am just going to add, if you're just, talking about HPV and obviously vaginal health, but let's just say, I mean, this really does impact the entire body. I mean, so if you are healthier there and preventing, to me, this goes to speak to how it's going to impact the health of the entire body. Because, a big word right now, I would say out there, people are constantly talking about longevity and or health span. And so this is the question that I'm constantly putting out there is, just because you don't have a condition or like an illness, right, which in some ways you're lucky to get the diagnosis of HPV, how many people are seemingly healthy because they don't have a diagnosis, but they have something, right? How do we define health? That's my question. Do you see what I mean? So in a way, this is like an opportunity. Does that make sense?
Absolutely. And so, even though having high risk HPV, there's no symptoms, right? So if you look in the textbook, there's no symptoms, there's no discharge or pain that women experience. The only way they find out they have high risk HPV is when they go in for a test. Mm-hmm. But I would say there are symptoms related to high risk HPV, and it's usually these things you're referring to, like fatigue, sleep issues, anxiety, bloating, maybe little weight gain that you can't lose, skin rashes, right? Brain fog, these things that just are like the symptoms that are like
could be anything
not being addressed by, maybe even IBS. It has a diagnosis, but there's not really, in the standard medical system, they just leave you with that diagnosis. Oh, you have IBS or you have chronic fatigue. But you and I would dig deeper. We'd say, what's under the surface here? This is not just something you're going to have to live with the rest of your life. This is telling us that something needs attention. And so you're absolutely right. Women are often, and even autoimmunity, very commonly I'll find women who are testing positive for HPV also have Hashimoto's or another form of autoimmune condition.
Compromised immune system. Absolutely. I mean, it's all connected. Going back to the beginning of our discussion today and COVID and stress and all of that, and how it all kind of is intertwined together. But it's basically the same message. Because I think about the men who, like you said, they don't get pap smears, and I mean, they're getting cancers from the HPV too.
They are. And I also see men in my practice. I'm helping men as well, and the same protocol that I use helps them too. These men are now being able to get the virus to go to negative and not cause cancer.
So how do they get tested? How do men get tested for?
Well, usually it's if they start to have symptoms or an abnormal tissue develops, or if they're from another country. There are some countries around the world where it's more easy for men to be tested.
Interesting, because they get it more in there are some other countries that have it more than we do, right?
Well, they have because the testing exists for men, but it's just that in the United States, it's not the standard of care to offer that testing.
Well, it seems like it since, I mean, they spread it. I mean, it's like it's like all of the other venereal diseases. Years ago when I was dating my friends, basically, like if someone didn't come with their sheet that they were clean, I mean, seriously, this is serious. Like, then forget it.
But that's not on. They don't. HPV is not on the list.
And it should, but that's what I am
a lot of
thinking.
women become very afraid to date. Women say, I just talked to a patient today. She's like, I'm afraid. She's like, it's not even worth it to me to be in a relationship because it's not worth it to me to have to deal with HPV again. And it really can impact women's psychosocial and sexual life and intimacy because of this fear. You feel like, oh my gosh, am I going to get exposed to this? And another fear that women have is, am I going to expose my partner to this? So women start to be afraid, hey, am I dating? I don't want to expose my partner to this virus.
Absolutely. That's what I'm saying. This is crazy. I think they should put it on the list.
Yes.
You know what I mean? Because that should be like on Match.com or whatever.
Well, and
like you have been cleared. You have been cleared.
Yeah, exactly. And the thing is, though, remember that the key is if we're going to test, I believe if we're going to test for anything, we need to know that there's a treatment for it, right? Because if we start testing and we have, like what's happening now for women, we're having more and more women test positive for HPV.
They don't tell them what they can do.
That means that there's a huge number of women who are in a state of fear, and the medical system's not offering them any help other than procedures and surgeries.
Yes.
So I believe if we're going to test, we need to be able to say, hey, if you test positive, here's what you can do about it to prevent it from causing cancer. And that's why I'm so passionate about giving this information out there to say, I believe that women should be able to be confidently able to be in intimate relationships without a fear of HPV, even if their partner might have it. Because the fact is that when we have your systems in optimal way, right? If your immune system's working, your microbiome's working, your vaginal microbiome's working, you've got your nutrients, you're protected, then you will be able to have sex either with the same partner or a different partner who may have HPV, and you'll be able to protect yourself. Because again, it's not just about exposure, it's about your body's protective mechanisms. And so I two things I'm saying, right? If we're going to test, we also need to be clear that there is treatment for it. So if men are being tested, they also need to know here's what you can do about it. And we need people to understand that it's not just about exposure, it's about your overall health. The more we can optimize your overall health, the more you're going to be able to protect yourself from it and not give it to someone else.
I love it. I think this has been such a great discussion and what a positive message. But I have come up with your next business venture, which I think should be partnering up with all these dating sites. This could be like huge. Because I think these people who passed that test that went through this, I mean, they'd be much more desirable.
It's true. That's true.
We'll have to talk to the
dating apps and be like, okay, if you're testing positive for HPV, here's what to do about it. Yes.
But also that these people are being considerate enough of whoever they're going to be with, and taking care of their health. There's a lot of discussions here.
Yes. And I think overall, it is about becoming more self-aware, right? How can we all, because the fact is, again, we're human. Humans are gonna have sex and be intimate. That's part of human nature. And humans are gonna get exposed to viruses and bacteria. We're gonna get exposed. So the key is, how can I, as a human, make sure that I'm taking care of myself and protecting myself along the way? And we don't learn that in elementary school. We don't even learn that in college. So we need to, if we can, now's the time. Let's learn how to take better care of ourselves, even when we're under stress, and especially when we're under stress, so that this doesn't have to then develop into something like cancer.
Well, I love it. This has been really informative, and honestly, it is such an important message, and we just got to get it in front of the right people, honestly. Because I feel like, like myself, like I said, I mean, I really was like traumatized in the moment, and had by myself the whole thing. So I think this is awesome. So thank you so much
You're welcome.
today. I think this was, again, very important message that we need to get out there. So thank you.
You're welcome. Thank you so much for sharing. And if anyone would like more information, I welcome you to reach out at my website at drdonnie.com. And you could put there, I'm sure you'll put there
I
the
will put everything in the show notes as far as how to reach Dr. Donnie and all of her resources. Everything's going to be in there. So if you have any interest at all, please go check her out.
Yeah, we have a free guide, we have a free workshop. So I'm really interested in just getting information because it's only when women have information that they can make informed decisions for themselves. And so please, yeah, I welcome you to come and get informed, and then you can get out of fear and into action to gain your freedom from HPV.
I love it. Thank you.
You're welcome. Thanks.